To me, yes, there were more toxicities with the quadruple combination, but we all knew that carboplatin, paclitaxel, bevacizumab can have additional toxicities. Now you add a fourth drug to it, so I don't think there were any new safety signals that were alarming because of this combination, but definitely a slightly more toxicity. And again, compare that to a triple combination of carboplatin, pemetrexed, and pembrolizumab, slightly less, but every time you add a new drug, that brings with it additional toxicities. Again, I have to emphasize what we've seen has been in line with what we sort of have been expecting from all of these combinations. But you have to decide when you see a patient sitting across from you if a patient is a more appropriate candidate for the quadruple combination or whether the triple combination is sufficient. Now, I think the other way to look at it is that now we have all of these various options for patients with non-squamous histology. You can use carboplatin, paclitaxel, and bevacizumab if that's what you've been working with. On the other hand, if that's not something you want to use, a carboplatin pemetrexed backbone can easily be adopted to a majority of patients that we see. So again, you have all of those options. And then you bring in Checkmate 227. Again, it's very hard for us to do cross-trial comparison because they're a different patient population, but you see that the combination of Ipi plus Nivo, roughly a 25% grade 3 or 4 toxicity in an appropriate patient with a high TMB, maybe that would be another option that you have for your patients to sort of trial. So I don't think I've seen anything that would tell me I would definitely not want to use one of these combinations. It's just that you have to be aware that, yes, you're going to have to deal with additional toxicities.
Atezo, like Pembro, can add immune-mediated toxicities to the typical chemo or chemoangiogenesis inhibitor regimen. Beyond that, there really aren't other major toxicity concerns. It should be noted that roughly a third of patients ultimately stop treatment at some point because of adverse events, not necessarily grade 3 or 4 adverse events, but because of some sort of side effect, compared to 25% in the control group, the Pac-Carbo-Bev arm. Intriguingly, only about 13 or 14% in the Atezo arm. So in a direct comparison, the implication is that Atezo may have a bit less toxicity than bevacizumab in this setting, but I think that may be overinterpreting some of the data. In large part, this regimen, although it's quite comprehensive, 4 separate drugs, is manageable. The toxicity is typical of what we'd expect. There are no major surprises.